Hi, I'm Emmett Reed, Executive Director of the Florida Healthcare Association. Welcome to another edition of FHCA's Provider Program.
This is a Tallahassee update from the Florida Healthcare Association.
The 2011 legislative session kicked off Tuesday, and there's no doubt it's going to be a tough road ahead for long-term care providers.
The first step to better times is acknowledging that government cannot afford what some have come to expect.
As you can see, the next 60 days will be a tremendous challenge. You can rest assured that your FHCA staff and lobby team will work tirelessly on your behalf. The House Health and Human Services Committee took up their Medicaid Reform bill, and Tony Marshall of our staff testified about a number of important protections that must be included to preserve nursing home resident quality care. Tuesday evening, over 50 employees from Gulf Coast Healthcare gathered for an update on our legislative priorities. I had a chance to speak with Gulf Coast President Craig Robertson about the critical messages they're sharing to lawmakers and the importance of being in this grassroots initiative. Tell me what your thoughts are on Lobby Wednesdays and why you make that big of a commitment to the Florida Healthcare Association.
Well, I think it's vital. I mean, if you're not playing, then you're standing on the sidelines letting us do all the work for you.
Next week, our tort reform bill will be up for a committee vote in the Senate, and we're asking our members in those legislators' districts to contact them and ask for their support of this important bill, which would save taxpayer dollars and enhance senior care by eliminating predatory lawsuits.
We met with 8 legislators today representing Florida Healthcare and talked about all the issues and got great feedback from most of them.
We went and asked for stable funding for the Medicaid program. We talked about our tort reform. We talked about the occupational taxes on our CNAs. Please don't do that. And we also talked about duplicity and eliminating all of the different surveys that we go under. We had a great day, guys.
Yes.
Great day in Tallahassee.
Great day.
Thank you.
Several important tort provisions reflected in Senate Bill 1396 were also maintained in the Senate Medicaid Reform Bill, which passed out of committee on Wednesday. I spoke to FHCA President Nina Willingham about why it's so important for member involvement and how your presence makes an impact when critical votes like these are on the line. I'm here outside of the Senate at the Florida Legislature with FHCA President Nina Willingham from Life Care Centers of America.
About 2/3 of that room was filled with nursing home professionals. There were administrators, nursing assistants, nurses, everybody that you can imagine all across that room. And I really think that had a tremendous impact on that entire committee.
And recent studies have shown that lawsuits don't do anything to improve that care. It was great to hear from a family member who was also in town meeting with lawmakers to share her firsthand experience about the excellent care her mother receives at West Gables Healthcare Center, an FHCA member facility.
And I have the privilege of having one of my residents, family members here in support of the Florida nursing homes. Millie Bencomo is joining us here. Millie?
I have so much to say about the center. The service is excellent. The center is magnificent. The care that they're giving to, not only to my mother, I see everybody because most of the time I am there, is excellent.
Hi, I'm Denise Coyote. I'm the administrator at Island Lake Center in Longwood, Florida. We just really having a great experience here with Florida Healthcare Association, and we just met with Representative Plecken from Altamont Springs, and he was right on board with our tort reform, and he had a wonderful experience talking about the elderly and really gave us a great opportunity to talk to him about our cuts and being able to negotiate what we need for our elder care. Thanks.
Next week, the Senate will be out for the Easter Passover holiday, with the House working just 2 days. In the meantime, FHCA is still doing our part to urge legislators to reduce the nursing home funding cuts, which amount to a $144 million cut in the Senate and a $202 million cut in the House. Another bill we're watching is House Bill 311 by Representative Ken Robertson, which helps clarify how cities should apply occupational taxes to persons who are employees of businesses that already pay the tax.
Right. Thank you. Well, House Bill 311 came about in the fall of 2010. The city of Punta Gorda requested an attorney general's opinion on who actually had to pay the business tax. And surprisingly, this attorney general opinion came back that said anybody who had any kind of state license, registration, certification had to pay the tax.
Throughout the session, we've had hundreds of long-term care employees with us at the Capitol, meeting with lawmakers about the need to preserve nursing home funding, ensure long-term care protections in Medicaid reform, and support tort reform to protect those precious Medicaid dollars. Okay, this report's going to be a little bit more informal than most of them because we're literally reporting on the fly from the Capitol about our important issues. Right now, I'm happy to report that all of our major issues, which are all heavy lifts, are still alive in the House and the Senate. Debbie, we got some news from the federal government last night, and I just want you to talk a little bit about how that relates to the importance of a successful Florida legislative session.
Well, the CMS has made a proposal that we're going to take 12% cuts on Medicare. And as you know, Medicare and Medicaid go hand in hand. We need both of those to balance to give the good care.
Today will mark the end of the 2011 legislative session. And this week's program includes an update of what we know so far. I'm standing outside of the House chamber with Representative Sean Harrison, where House Bill 661 has just passed the House. And Representative Harrison, you obviously had a big hand in this bill. Just talk a little bit about how you feel.
I feel great. It's a great bill, actually. It started off a little bit bigger, a little more aggressive than the ultimate final product, but we got something that we could pass. It still offers protections that are much needed.
Thanks to your intense grassroots advocacy, we secured important protections for long-term care in the final Medicaid reform package, reduced the funding cuts down from the House conference package by $58 million, and obtained staffing flexibility to help you offset your costs. Your letters, phone calls, and visits with lawmakers throughout the session and in these final days made a huge and positive difference. Until next time, I'm Emmett Reed, keeping you informed about the critical issues that impact long-term care and the providers we represent.